Hi, my name is Amy Nunn. Can y'all hear me?
Put the button up so you can hear you. Thank you.
My name is Amy Nunn. I'm an assistant professor of public health and medicine at Brown University, and I hold master's and doctoral degrees from the Harvard School of Public Health. I spoke here at World AIDS Day with Governor Lincoln Chafee, and I'm also here representing many physicians who couldn't be here tonight because they're at a large AIDS conference in Seattle. But a lot of those people are responsible for the care and treatment of most of the Rhode Islanders who are living with HIV, and they've also submitted their written testimony in opposition to this bill that's informed by their over 40 years of collective experience caring for people living with HIV. So I am vehemently opposed to this law. I don't think that this will advance public health in any way in this state. There are a lot of reasons to oppose this, and we've heard a lot of them already about discrimination and also an assault on the civil liberties of the most vulnerable populations living in our state. But I want to talk to you today as a scientist. I want to talk to you about the data and what we know that works. There is absolutely no scientific evidence at all to support this approach. This approach is not grounded in what we know works for HIV prevention. I'm speaking in the context of my training and 15 years of experience working in the field of HIV/AIDS. This is an approach that is grounded in fear. I want to talk to you about what does work, testing and treatment. One thing that we haven't talked about is how far we've come in Rhode Island. We are probably the state in the union that is closest to getting down to 0 new infections and actually eradicating HIV. That would be a public health triumph. It's really important to remember how we got to where we are. It's because we have had really progressive policies about testing and treatment, and we have begun, and many people, and Rhode Island began testing and treatment in correctional facilities about 20 years ago. Those have had ripple effects on the public health of Rhode Islanders, and we are now down to under 100 new HIV infections, which is a public health triumph by any measure. We know that testing and treatment works. I want to talk to you a little bit about the data on that. Testing and treatment are most effective HIV prevention interventions. That's because people who test positive for HIV are much more likely to change their behavior. And most importantly, they're also much more likely to take treatment. If you are taking antiretroviral medications, the chances that you will transmit HIV to other people are tamped down to nearly 0. That is what works, testing and treatment. And encouraging people to get tested and to take medications this bill will not advance those goals. It will send people living with HIV back into the shadows at a time when what we're trying to do is actually eradicate HIV in this state by expanding testing and treatment. We have a visionary lead at the health department who is trying to make this reality. I don't know of any other, the director of any other health department who's actually pledged to try to eradicate HIV. We are so close to doing this, and this bill is going to take us in the wrong direction. It's absolutely not grounded in science. And I also want to talk about those 35 other states. In response to your question about when those bills were implemented, those were by and large passed in the 80s and 90s. At a time where there weren't life-saving medications to save people's lives. And Rhode Island is one of the few states who's actually moving in the wrong direction with this legislation. Most of the states are actually rolling back this legislation. If we enact this, we're going to be out of step with the policies of the following organizations: the U.S. Center for Disease Control and Prevention, the United Nations Program on AIDS, the Presidential Advisory Council on HIV/AIDS, the U.S. Conference of Mayors, the American Medical Association, and even the White House. No one is supportive of this legislation. It is not grounded in scientific evidence. It's bad public policy, and it institutionalizes discrimination. The last thing I want to say is that there is a misperception that people knowingly transmit HIV. People do not deliberately infect others with HIV. What we know about the scientific data on this issue is that 50% of new infections are transmitted by the 16% of people who are living with HIV that don't know their status. What we need to do right now is make a big push to get those 16% of people out to get tested and not send them back into the shadows and not threaten to lock them up if they unknowingly transmit to others. What we want to do is get them tested and on treatment and into our extraordinary care centers. So in light of all of these reasons, the fact that this is discriminatory, it's not grounded in any reliable scientific evidence, and it rolls us back into the 1980s and the 1990s, I strongly encourage you to vote against this bill.
Thank you. Any questions?